Welcome to Health Live at Seniors Today. We are delighted to welcome here Dr. Sandeep Gore, who is an emergency medicine specialist. This session is being conducted on September 13th, 2025. Those of you who are regulars, you know that we now announce the date of the session so that in case you're watching it 2 years later, you know that it may be good to update yourself with newer developments in the medical science. The topic that we've invited Dr. Gore to speak on, and on the basis of his suggestion as well, is first aid and emergency medical aid for seniors. Before I invite him, I'm going to speak a little about him. Dr. Gore is a distinguished emergency medicine specialist with over 17 years of experience. He serves as director in the Department of Accident and Emergency Medicine at the Fortis Hospital in Mulund in Mumbai. And he's also the chair of the Emergency Medical Council at Fortis Healthcare across the country. He's instrumental in shaping the future of emergency medicine as the national vice president for the Society of Emergency Medicine in India. He has made tremendous contributions in the field. He's a unique combination of physician plus public intellectual, whose expertise in multiple areas has redefined emergency medical care in India. He graduated from the BJ Medical College in Pune and completed his fellowship in emergency medicine from the CMC, Christian Medical College in Vellore. He has achieved the membership of the Royal College of Emergency Medicine, qualification from UK and European board certification in emergency medicine. There's just so many attributes to him that can speak about. But something that I got to know when I was speaking to him earlier is that he's also a regular Himalayan mountain climber. So, and he does that to de-stress himself. So welcome to Health Live at Seniors Today, Dr. Gore. How have you been?
Thank you. Thanks for the generous introduction, and I'm very much delighted to join this particular forum.
Doctor, before I request you to make a presentation, I just wanted, emergency medicine people know because there is an emergency ward in every hospital. But could you define what is emergency medicine for our audience here today?
This today's our presentation is exactly delivering what you have asked. Means what is understanding the emergencies. We talk about the what to be done in emergency, but recognition of the emergency is very important. Once you recognize emergency, then only you will act. So recognition, to understanding what is emergency, to recognize emergency, and act on these things. So this presentation will be like that thing, and that will be followed by the questions and answers.
Great. Thank you, Doctor. So over to you and over to your presentation. So as always, do note that Doctor is going to be making a presentation, but it's being recorded and it will be there on our site on Monday evening. So don't worry, you don't have to take notes. Also remember that these sessions are advisory in nature. So, in case you do have something that needs to be attended to, then it's best to go to a medical practitioner in the vicinity of your home or whosoever you go to, whether in any part of the country or the world that you are in. Over to you, Dr. Gore.
Yeah. Can you see my screen now?
No, I can't. We can't see your screen.
I'll just.
So there are around 200 people who are attending today just now, and a good number of people on YouTube as well.
So very good evening for this particular session, and I thank you, Senior Citizen Platform, for inviting me and allowing me to talk on this particular topic, which is very important to be discussed, and that is emergency awareness. So basically, what we are discussing, what is meant by emergency? Emergency is an injury or illness that is acute and poses immediate risk to a person's life or long-term health, unless we do some medical intervention. So emergency, it can be injury or illness, and if it is not addressed, then that can lead to the immediate risk to the person's life or its long-term health. What are the medical emergencies? Can say heart attack is a medical emergency. A paralysis, weakness on one side of the body is a medical emergency. A patient posing breathing difficulty is a medical emergency. A patient who is not responding to calls is emergency. Accident, road traffic accident is emergency. Poisoning is emergency. Bites and stings, they are important emergencies. So when you call, everyone is aware about heart attack. Heart attack patient generally comes with retrosternal chest pain radiating to back, jaw, and left arm, and profuse. And patient also experience profuse sweating. The causative, we have two sets of the causative factors. Preventable. Why I am sharing? Because we can act on preventable things like diabetes, obesity, high cholesterol, high blood pressure, excessive stress, and smoking. We can stop this. Unpreventable, ethnicity, hereditary, age, gender, which we can change. So changeable is that one should be aware about these preventable and changeable risk factors, and we should reduce the obesity. Diabetes, blood pressure should be normal. Why this heart attack occurs is whenever there is sudden blockage in the blood vessels which is supplying to the walls of the heart, heart attack occurs and patient presents with the chest pain. So what we should be doing? One should not neglect the chest pain. Sometimes burning chest pain also, one should not be neglecting that. Sometimes people think that it's a we have seen many patients who neglected chest pain like acidity and all this thing, that one should not neglect that burning type of chest pain, or any chest pain they should not mimic. And each and every chest pain that must be evaluated by qualified medical person. So how to evaluate chest pain? This patient should go to the emergency department where we do the ECG, and we do one test that is called a high sensitivity troponin I, and echocardiography, and based on that thing, we either consider label it as a cardiac pain or non-cardiac pain. If a pain is due to the heart attack, we can dissolve that clot by giving injection or sometime, and the gold standard is angioplasty, where we remove that particular blood clot supplying to the myocardium and revascularize that particular wall. So important time is hard. One should not neglect the chest pain. The first stage is that you should be spreading the awareness that even young patient. Nowadays, if you see the newspaper or social media, people in 30s, 40s, they are dying due to heart attack. Some of our colleagues whose age is around 40s and 45s, they died due to heart attack because, and this is not age dependent. That now paradigm has shifted. Earlier, the heart attack used to be more in 60s. Now it's in the 40s and 50s. So one should not neglect the chest pain, and that chest pain has to be properly evaluated at the proper center. And of course, as a means you can spread this awareness. These cheeseburgers, we should and pizzas, this culture should not be allowed, encouraged, because already being Indian is a risk factor for heart attack. And if you take all these things which are not suitable to our climates, then patient may develop cardiac these things. So if you don't listen to heart, then we are bound to get one big punch from heart. Another is a stroke. This is very that is another thing that it's like a brain attack. Whenever there is a clot in a vessel which is supplying to the brain, sudden clot, that will cause a paralysis, and that is called as the brain attack. So the heart attack and brain attack, the concept is behind that. Blood vessels which are supplying to heart or brain, if suddenly get clot by the blood clots, patient experience the heart attack or brain attack. So we have to be very quick. This is important concept that one has to spread, that if we go to the hospital within first 3 hours of onset of paralysis, by giving the proper injection that is called as alteplase, we can completely revert the deficit. Now that window has extended to 4.5 hours. So if a patient reaches to the hospital within 3 hours or 4.5 hours, then we do the CT scan, and we give this injection that is called as that dissolves the particular clot and revascularize the brain cell. So brain attack and heart attack, their pathophysiology is same. We have to act within a given timeline, because if you don't address them, it can cause mortality as well as morbidity, and always there is a prevention is always better than cure. So one has to protect the brain, and any emergency is a race against time. So timely diagnosis and timely initiation of the treatment is life-saving. So Sachin Tendulkar, I consider a god of cricket, but he has to play within the rules of the game. If you don't reach in the time to the crease, he will get run out. So the same applicable in the medical emergencies. We have to reach to the proper place within a timeline so we can overcome on that particular emergency. So what should be what two important takeaways should should be there, that one should not neglect the chest pain. It can be burning chest pain, and chest heart attack is not limited to the elderly. It can occur in young people also. And another thing is that time is a brain. Everything is time bound, so we have to be very much time bound while taking a care, delivering the care. Okay. Now, in acute stroke, in brain attack, we must be considering one thing, that um, within 3 hours or 4.5 hours of the onset of the paralysis, if we reach to the hospital, we can revert it by giving the proper medications. Now, the asthma attack. Asthma attack is a severe breathing difficulty. It comes to this small, we can see the bronchial tubes, they get constricted due to the allergens, and patients experience severe breathing difficulty. To acute asthma attack, what should be done? The patient who have asthma patient in home, they should be avoiding the animals, pollens, cigarette smoke, or birds in nearby the house, and certain food which they are allergic to. So, and dust. In medical emergency, best is to prevent. So I am talking about prevention rather than first aid. It's also important that to prevent that particular illness, and we should be use inhalers immediately. Asthma patient should have 2 to 3 inhalers placed at different places in the home, and whenever he gets asthma attack, he should be using this puff. And in severe attack, continue inhalation, and if it is not reverted, then this patient should go to the emergency department. Unconscious patient, a patient who is not responding to call, that is also an emergency. That many times we saw patient go and feed the patient. They thought they are doing first aid. So no, but feeding an unconscious patient can kill the patient. Means sometimes that feeding can go into the ear pipe and patient's heart gets stopped. So that will not help. So unconscious patient, we should not be feeling. We should be any unconscious patient, we should go for and ask for the medical help. That patient should be rushed to the emergency department. We should not try to feed that unconscious patient. Rather than, we should be keeping this patient into the recovery position on the, we can say, on the left side of the patient with head towards the lower side. So that will help to secretion come out. And this is also important that to recognize sudden cardiac arrest. A patient who is not responding, his heart can be also stopped. So, and in this time, we have to pat both shoulders of the patient. And if he is not responding, one should check the pulse. The pulse should not be wrist, that is a neck pulse. And we should be checking whether that pulse is present or not. If pulse is absent, then we should be doing the chest compression. As a senior citizen, means in Western countries, everyone know how to do the basic life support. So we should be doing this particular chest compressions. We have to do this 100 chest compression per minute continuously. So while using these things, the hip joint one should be using as a fulcrum, and arm should be the piston, and upstroke and downstroke, this should happen. And we should be rushing to emergency department. If required, we can give a shock. And if patient is not breathing, that time we put the patient on ventilator and ventilatory machine. Another thing I would like to address very much is that India has become the capital of road traffic accident. 12% of all death due to road traffic accident, and we can see this, the death who occurs into the road traffic accidents are young individual whose age between 15 to 45 years, and they are sudden, and nobody is immune to the road traffic accident. So it's our duty that we should be going ahead and helping the road traffic accident. And the golden hour, that first hour after the trauma, is very important. Simple measures like giving oxygen, opening the airways, or removing the air which got trapped into the chest can save the life. So one should be going ahead and helping out the trauma victim. And many people think that if they help out the trauma victim, the police will go and come against inquiry. Nothing happens. As soon as you have taken this particular patient of trauma patient to the hospital, any nearby hospital, your responsibility get ends, and it's bound on hospital to give golden hour care for that particular patient. So the first takeaway for the trauma is that one must be helping a trauma patient. Wherever you get trauma patient, we should be taking the patient to the nearest hospital. And once you take that patient to the nearest healthcare care system, it is as per a good Samaritan law, it's bound on that healthcare facility to give the golden hour treatment, irrespective of the financial status, religion, or whatever these things. We have to, that healthcare facility has to provide the golden hour care. So that awareness we have to spread in these things. Another is that head injury is another bad thing that we can say that that can make a person very much debilitated. In head injuries, certain things that oxygenation, securing airway, and ventilation can be life saving. So, in polytrauma cases or head injury cases, every time time-bound care is important, and golden hour care, that first 1 hour of patient care, is the life-saving. Simple measures like giving just IV fluid or giving just oxygen or removing the trapped air or putting the securing the airway. The simple managements also can be life-saving pattern. So I think that we should be spreading this awareness among the public places. So do not hesitate to help an accident victim. Take a victim to the nearest hospital, and we should be always dare to care, because as a humanity we have to help out the victim, because nobody has immune to the trauma. We have taken the vaccination of the polio, we have taken the vaccination about the COVID, but nobody has taken the vaccination of trauma. So everybody walks, go for a walk, everybody drives, and everybody is prone to trauma. So as a humanity, it's our moral responsibility to help out a trauma victim, to take them to the nearest hospital. And of course, one should be helping yourself also. If you, sorry, if we are using a cycle or bicycle, we must be using helmets. Because head injury means it's a very common thing, and many times we saw the people who got a severe head injury, they haven't wore the helmet. So make sure that while you are sending you are making a simple cycling also, or you are going on a bike, or your family members are using bike, one should be making sure that they must be wearing the helmet. This one particular public awareness poster I liked. I think I clicked in Pune only. At Pune, people are very much creative in such idea. I don't know, they don't use helmet, but they create such beautiful things. Take care of your head. Not everyone get replacement like me. Wear helmet. So we must be spreading this particular awareness, and people should be wearing the helmet. And the first aid in trauma is that rush that patient to the nearest hospital within first hour, because golden hour care will make big change, and nobody is immune for the trauma. Another is that India has become, but this stray dogs are lot there, lots of their stray, and dog bite people do neglect, and India has become capital of rabies, means highest number of death happens in India due to the dog bite. So if dog bite is there, that dog bite, one should not overlook that thing, that should be addressed. And whenever we are taking that dog bite, we should be taking to the hospital rabies vaccine, as well as immunoglobulin is required. So in these things, why I am talking about dog bite, because once in a year we see a rabies case, and once a patient gets rabies, there no person with rabies survived so far. So it's very important that even if we have a pet dog or a stray dog with simple scratch or dog bite, we should not be neglecting that. Even if a pet dog is vaccinated, we should be dog bite cases, we should be going in the hospital and taking the appropriate medical measures. Okay, so basically one should be aware, one should be spreading the aware, we should be helping the victims, and emergency awareness is that always there is one's right intervention should be at right time. And I can say this proverb, stitch in time saves line, it's mostly applicable in while delivering the emergency care, because emergency care is something which is very much time bound care. So if you cannot give a life, you can save a life. Life is precious, and one should make it healthy. Thank you very much. Now, I think I can open this forum for question and answers. You can ask any questions, whichever you feel like
Thank you,
asking.
Doctor. Thank you very much. Thank you very much for a detailed presentation. Doctor, I'm going to ask you a question about, um, you know, you are aware of the kind of traffic that exists in the city, in our various cities, whether it is Mumbai, Bangalore is really bad. Even your, old city of Pune has so much traffic. Given that, what are the challenges that exist for emergency medicine? And even ambulances, they just have no way to get out and reach the hospital.
Yeah.
What is
Yeah,
your
it's a very
suggestion?
important questions, and I think we have to do the lots of public awareness campaign, and we have to pressurize government also on these things. We do heart transplant, we do lung transplant, but we can't give guarantee that we will get ambulance within 10 minutes in a home. So that one thing we have to address these things, and pre-hospital medical services. Now, if you see, if I want to go from Mulund East to Mulund West, such a small distance, it may take half an hour or 1 hour. So if somebody is there, though, there, so it's very difficult to go for an ambulance. In UK, that everywhere in UK, ambulance reach within 12 minutes. So publicly and government, we have to work on these things, and there are challenges. Sometimes a patient get arrested. If heart get arrested, it gives you 3 minutes to restart. Within 3 minutes, you didn't restart that heart, then patients become brain dead. So that time bound care is required, and yes, we have as a country we have big challenges on these things. We have traffic, we have population, but yes, situations are changing. We are hopeful that we will change these things. But yes, the thing which we have to work on this thing is the pre-hospital services in big city like Mumbai also. If something happens, you will not get you guarantee that within 15 minutes you will get ambulance.
So, Doctor, I have a suggestion, and we have got a few questions, but on this point, we have a large number of people over here, over 200 people here, 1,000 people attending on YouTube right now. Should people who are living in large housing complexes,
Huh.
should they perhaps get a place kept for ambulance in a large housing complex, so that at least the ambulance is available? And then, of course, one hopes that there is some civic consciousness and people give the right of way to
Yeah.
a ambulance.
No, no. Your question was right that in housing societies, what can do? They can put external defibrillator. The defibrillator, that shocking machine, the which we use in a hospital, it costs around only 1.5 lakhs, and that should be available in every housing complex. Because if we are yes, and we should be encouraging the CPR, the chest compressions, just chest compression 100 minutes per this thing, and we have to apply that machine, and that machine will recognize the rhythm and it will shock on its own. Now that AEDs are available on airport. In France, that AED is available on light poles. On every uh, light pole, we can find that particular AED. So, in large housing societies, what one thing we can do, we can keep this automated external defibrillator that is called as AED, and that is one shock can be life saving these things. So, one thing that and in housing societies also, we should be taking a campaign. They should be knowing how to give the basic life support. The college going students are there, senior citizens, active senior citizens like you are there, and it's very easy. We have to do the just chest compression, and you have to attach the AED, and it will shock. The exactly what can happen in a hospital, that can happen in your society. But that is one thing is very crucial, and we should implement, and we that should be the takeaway from this thing. All housing societies should have AED, and it costs only 1.5 lakhs rupees, and it can save many lives if it's used properly. And if as far as ambulance and medicines can, when we can see this medicines now, in medicines you can't give medicines, you can't give injectable medicines there, because for injectable medicine we have to means as per a constitution or as per law, you have to be a doctor to give some injectable medicines. But yes, for basic life support, you are empowered. If you have get training, you can give the basic life support that includes chest compression and delivering the shock. So that one thing we can keep in these things. And yes, every society should have some first aid kit. They should have some important medicines that they are prescribed by their family doctors, or if some doctors in are available in the society, with his advice they can keep certain medicines which can be delivered whenever required.
Right. Thank you, Doctor. Um, Doctor, this is a question from Kiran Agarwal. How will you know a person is about to have a brain attack? What are the symptoms?
Listen, this emergency comes without any warning. That's why it's called as emergency. So, so suddenly somebody gets chest pain, or suddenly somebody face weakness. That's it. So it attacks at more means suddenly. That's why it's emergency. But when it happens, if somebody started sudden slurring of speech, or facial deviation, or sudden weakness of one side of limb, then we should recognize this and that patient should rush to the nearest hospital. Within first 3 hours, if that patient reach to the hospital, he can be completely ambulatory, just like normal or near normal, how it was this. So they don't come with any signs, but when they come, we have to pick up very quickly and very astutely. One of the senior citizen, he was reading newspaper. He was in Airoli only, 75 years old. While reading, suddenly he realized that he can't read, and he himself recognized. He called ambulance and he came, and it was occipital infarct, the area of brain which controls vision. He himself diagnosed and he came, and then we did the MRI. We saw that infarct and we thrombolized, and he immediately started reading. His all eyesight came back. Sometimes that astuteness and that vigilance required from patient and patient relative side also.
Right. This is a question from Shamla Ravi, and we have a question from Anil Singh as well. What are the preparedness plans in case of an emergency? And what are the minimum basic things or medications that one must have or available in one's emergency kit?
So in emergency kit, you can keep in home, in emergency kit, if you have asthma patient, you can keep the extra inhalers in your home. And if you have a heart patient or diagnosed heart patient, you can use this, you can keep this anti-anginal medicine, the sorbitrate tablets or the tablet like aspirin tablet that will help to prevent the thrombus formation. And of course, this certain analgesics you can keep available. But the main thing is that I'm again reiterating one thing, that when chest pain is that we should not be wasting time. We should go and address to the nearest hospital. If somebody is having back pain, knee pain, that you can give the local analgesic. You can use the spray. Headache also, we can somehow you can take a paracetamol. But we should not be neglecting the chest pain. So for this headache, back pain, or knee back, you can keep our regular analgesic like ibuprofen or paracetamol. You can keep in your kit. But chest pain, certainly any chest pain, one should not neglect. Any heartburn or chest pain, I don't recommend to give anything. One should go ahead and seek out for medical aid.
Doctor, since you mentioned about going to the hospital now, one doesn't have a large hospital in one's vicinity always. Not everybody might have the privilege of. So is it okay to go to a small nursing home as well, or should one go to a large?
Yeah. At least this, you should be going to the qualified medical person who can do the ECG and who can evaluate the chest pain. He can differentiate whether the chest pain is due to cardiac or non-cardiac, and that's very important. So you can go to the nursing home, but you should not be neglecting that thing. At least one ECG should come. So major heart attack, 100% you will get appear on these things, on ECG. Sometimes if it's not appear on ECG, one blood test called as high sensitivity troponin. If that is negative, then we can rule out that thing. So we should be going at the medical aid, a qualified medical person who can evaluate and take a appropriate call. You can go to your family physician. One person I saw, unfortunately, he applied Jhandu balm or chest pain, and finally he become unresponsive. So these things one should not be doing. The first aid should not be like that. Ki, sir dard ke liye Jhandu balm lagaya, I can understand, but chest pain ke liye you can't applying do all these things. So basically, when this particular topic came, I thought I should spread this awareness rather than telling about the what to be done in first aid.
Right. There are two questions that have come in. One is from Shailaja, and the other is from Sunita Verma about bee stings.
Bee stings.
What about bee sting and its danger, and what can you do if you have a bee sting?
Bee sting can kill if a patient is allergic to that bee sting. Suppose a bee sting means the bee sting means honeybee. Anything that any bee, whenever it stings, sometimes it stings to one person, nothing will happen. Because in the bee stings, sometimes due to the bee sting, if patient get allergic to that bee sting, that can be life-threatening. So we can't know that which person will be allergic to that bee sting and which will not. So we should be always keep ourselves away from the bee sting. But even if bee sting happens, one should not be afraid. It is not always lethal. It's like a medicine allergies. Sometimes certain medicines are very much lethal for a patient because they are allergic to that medicine. So like if a bee sting, if the person are allergic to that bee sting, particular bee sting, then it can be lethal and that person should be rushed to the hospital. Then allergy features, patients develop itching, rashes all over the body and breathing difficulty. So that patient should be rushed immediate to the hospital.
This
But
is a
yes, if this thing happen, only local pain happened, nothing happened, then you have to remove that stinger. That's it. But at the same time, I recommended that you should go and check your BP and vital signs to your family physician. Not always it's lethal, but sometimes it can be lethal.
right. We have a question from Gyan, who asks, what are the main differences between a gastric problem and a cardiac problem? How can we distinguish between them?
The cardiac problems are generally sometimes in female, especially in female, because there is one terminology called as gender specific emergency medicine. In males, heart attack present like retrosternal chest pain, profuse sweating. But in female, it can present like some uneasiness. Means sometimes they don't know what happens. In females, they present very atypically, and that can be due to like a gastric features also. But yes, gastric features, dyspepsia is there, and they are associated with some food intake. They are associated with some gases formation and abdominal discomfort. Chest pain is basically retrosternal, which is radiating into jaw and back. So we can differentiate, but sometimes, especially in female, heart problem can present like a gastric symptoms, and that one should not be neglected.
Right. Sarita Agarwal says sometimes at the time of heart attack, the pain is in the right hand in place of the left hand, so we don't recognize it.
Very rarely, generally it radiates to the left hand. Means the classical feature, we means what we can call as a classical feature of heart attack is the retrosternal chest pain radiating into arm, jaw, and back. Occasionally, it can go to the right hand also, but most of the times the classical patient come with feature. Atypical presentation can come like they come with gastric feature, they come with right-sided pain. They do come, but we should not neglect in the classical features. So atypicals are very rare.
Right. This is a question from Katie Dadanchi, who says delivering CPR is not easy for us seniors at home, as we need to put pressure on the chest and also open the patient's mouth and breathe in.
Yeah, it's a very question, important questions. Now, initially, for a lay person or bystander CPR, 30 chest compression and 2 rescue breaths. Means after 30 chest compression, it was advised to give you two rescue breaths. But now that 2 rescue breath has completely removed. If you are non-medical person and if you are giving CPR, just focus on chest compression, and the rate of chest compression should be 100 chest compression per minute. No need to breathe. Whatever the exchange of air happens, whenever you are doing the chest compression, that gaseous exchange happens. So nowadays in American Heart Association also, for lay person, they just ask to give the chest compression only, hands only CPR, no mouth to mouth breathing. This is a new thing. I think due to that patience, I could be able to share this thing. Hands only CPR. Even if you go and check on Google, hands only CPR, you will come to know what is exactly. So you just give proper chest compressions and you call for ambulance and do chest compressions. Until the ambulance comes, or if you have AED in society, attach that thing, that AED will take care of shock and other things. But yes, now you are telling about the senior citizen. Why can't they do? I saw some senior citizen, some of my patients who are 75 years old and they walk some 9 to 10 kilometers per day. My father running 75 years. Every day he walks for 9 kilometers. They are more fitter than 40 people who are in 40. So age is just number. Your physical means you can do means if you are fit, you can deliver these things.
Doctor, can I make a request to you? You mentioned about CPR. Is it possible after this session, if you can send us a link to the ideal CPR?
Yeah, I will send the link.
You can perhaps give it to your team, and then they'll pass it on to me, so that when we have the takeaways, we can publish it. We'll publish the thing as to what is the desired method of CPR.
Yeah, hands only CPR. I can share you. I have put some slides also during presentation, but I will share that video. That video will make a better influence. And even if nowadays learning become very easy, even if you go on Google and search basic life support for lay person, you will find lots of videos, and they are all good. Even American Heart Association had that videos. Hands only CPR. But still, I will share the link.
Doctor, I'll just go through a few questions quickly. This is from Sushma Agarwal, who says, "My husband liver problem में कौन सी medicine घर पे रखनी चाहिए for emergency?"
Liver problem, हाँ, liver problem. I didn't got the.
No, her husband has a liver problem. So, what medicines should she keep at home
Yeah.
as emergency?
But what liver problem? There are lots of reasons for the liver problem. Obesity can cause a liver problem. So rather than keeping medicine home, I advise that he should reduce the weight.
Right. This is another question from Gyan. When I'm taking Xarelto 20 daily, will aspirin along with Sorbitrate work in case of an emergency?
No, Geralto I will not recommend because Geralto is absolutely not recommended. It is anticoagulation, and one should not be taking Geralto at layperson's level. Means you should use this particular aspirin and other this angiostrate that is called as sorbitrate. But Geralto is absolutely not recommended because it can cause profuse bleeding.
Right.
Sorry.
Yeah. This is about burns. What should one do? Anupama Singh is asking, what should one do to help if someone has a burn?
Best thing for burn is to prevent damage, and preventing the damage, first simple important first aid is that pour water on that thing, copious amount of water. If somebody has burn, pour copious of water, and that will prevent the further damage to the further skin layer. So one thing, use copious amount of water and cold water, and we should be putting on these things, and that will prevent the further skin damage. And after 10-15 minutes you can seek for a medical, but timely washing the wound with copious amount of water will prevent big damage.
Right. We have a question from Kamna Kapoor, who's asked, if someone falls down with force and muscular pain doesn't go even after taking cold packs in that area, what should one do at that time?
Yeah, that time you can take this simple analgesic which we keep in home, like we can see this ibuprofen or diclofenac sodium. With this, these all miss aceclofenac and paracetamol combination, myspas 4. These tablets are make a first aid kit from your family physician. They will write these things, and then they can use these things. But generally, if it's not cold, I will suggest one beautiful suggestion: rather than taking oral medicines, they should be using the Volini spray, local analgesic spray. That works beautifully.
Right. Thank you, Doctor. One last question, Doctor. This is also concerning your hobby for high altitude treks.
Yeah.
What are the preventive medicine that one should take?
Yeah, this high altitude means that many things, that it's very important questions. I think I have written one article in Times of India about this high altitude emergencies for especially elderly people who are going to the Char Dham Yatra. They go to the Badrinath, Kedarnath, and all these things, and without preparation, sometimes they go there. And these yatras are actually a high altitude treks. So without proper precaution, when people go there every year, 100 200 people die there. So to prevent that thing, if somebody is going for this, they should be going to the Char Dham Yatra, because the beautiful nature is there and spirituality is also there. But they should prepare. They should be walking every day for 1 hour, and after that, before starting the yatra, they should using the tablet called as Diamox, that is acetazolamide, 150 mg, means 125 mg BD, means before flying towards this their base village, they should be taking this tablet, and that particular tablet prevent the high altitude illness, and that prevents the death. Means a couple of years back, within some 15 days, 100 deaths happened in Char Dham Yatras. And that time it was a big story. Means Times of India has covered that particular this thing, and we did lots of awareness about this thing. Why these people? Because they are doing that. Exercise is not enough. Sometimes you require certain medicines to prevent high altitude illness. Even if I go for 6,000-meter mountain, 7,000 meter, we take that tablet, and with that tablet, we will not. The chances are very less to get high altitude illness. And once high altitude illness happens, like cerebral edema, means there is swelling on the brain, or if water get accumulated into lung, then it becomes very lethal, because very limited medical facilities are available there. and patient may succumb to death. So it's a very important patient you brought. And nowadays we can see there are lots of trend is there. People are visiting this Char Dham and all these things, and they should visit, but they should visit with proper precautions and with proper medicines. Yes, Diamox, 250 mg Diamox, half tablet morning and evening. One patient I saw that Diamox twice a daily, that 250 mg Diamox. We have to make a two part, one half in morning and half in evening.
Thank you, doctor, very much. You've asked an amazing, answered an amazing set of questions. We've had around over 200 people here and 1,000 odd people attending our live session on YouTube. Doctor, two things. One is if you can share the video with us whenever by before Monday, and the other is that we would be delighted to carry the article that you're speaking about for treks. Because even if you don't go to a trek or the Himalayas or wherever, even if it's a small trek somewhere, even then it's good to know what to have in case whatever there are. If you're going to say Ladakh or
it's Ladakh is very important. Ladakh is a high altitude place, and many people think that physical fitness is not allowed. Sometimes you require some medical support also. Even in the people who climb Everest, they also take this Diamox medicine.
Thank you very much, doctor. Thank you to the team at Fortis for facilitating this. The reason why we've had this session today is because September 11th is First Aid Day, World First Aid Day, and which is why we thought that we will have this session. To all of you here, thank you for being here. We will be back again next Saturday at 5 p.m. But before you all go, I have to people who have gathered here a sneak peek into our September issue of Seniors Today. I'm going to request. It's not out yet, but it'll be out on Monday. But since all of you are here on the 13th, I'll request our producer to share the screen and give you an idea of what the September issue is there. Do we have the cover? Sorry. I am not very sure whether we have the cover. Firoz, do we have the cover?
Firoz is not here.
Ouch. Okay. All right. Sorry. The cover is not there, but I'll tell you what it is. So we have a special story on the royals, the relevant royals, as the royal and relevant, which is on the Baroda royal family. So we have got a special interview and an article on that. It's a little different from there. We have also an article by Mr. Harsh Goenka. There was a question asked about dog bites. So we have a question on stray dogs and dealing with them, because that's controversy has been there for a while. And September 18th is Shabana Azmi's 75th birthday, or rather she turned 75 on September 18th. So we have a special on that. Yeah, we have our art director who's now sharing his screen, and yeah, so this is it. Royal and relevant is the thing. You see the Rajmata there, and this is the thing. So thank you very much for displaying the image. So do look out for it on September 15th, and thank you once again, Dr. Sandeep Gore, for this session. Doctors like yourselves, especially all doctors, have an amazingly I shouldn't be saying, have a crazily stressful life, and people who are in the emergency sessions, emergency wards across Indian hospitals have a really stressful schedule. So all power to you and good health to you, and all of you there, please take care of yourself. Some parts of India, in Mumbai, in Pune, it's raining a bit, so take care of yourself, and we will be back again next Saturday at 5 p.m. Do remember, Seniors Have Talent, the 19th season starts on September 17th. Our next issue is going to be out on the 15th, and of course a host of programs that we have as part of Evergreen Club. Thank you very much.
And thank you very much interacting crowd, and they have asked me very specific questions, and it was very much pleasure to interact with you all. Thank you very much.
Thank you very much. Thank you.
subscribe now and press the bell icon. Never miss an update.